Hey, in this video, I'm going to tell you everything you need to know about patellar tendonitis, which is also known as jumper's knee. I'm going to tell you all about the symptoms, the diagnosis, and the treatment, and as well as the root cause, which is rarely talked about in the healthcare industry. I'm going to make sure to give it to you here by the end of this video. So first things first, let's talk about the symptoms of jumper's knee or patellar tendonitis. So let me just give you some quick anatomy so you know where it's going to hurt, because that's one of the number one things to diagnose. Here's the patella, that's the kneecap, that's a sciencey medical term for the kneecap. And right below, at the bottom of the kneecap, there's a tendon, sometimes it's also called a ligament, that runs from here to here, the bump on the shin bone. You can see it on this knee model. It's got this long thing here. The reason why this is all connected, it looks like it's all one piece, is because the fibers are actually kind of continuous. This is the quad tendon up here, and then it covers up the kneecap, the patella, and then it runs down and attaches to the front of the shin bone. And it's usually right here at the bottom of the kneecap where people have the pain, the tenderness, and even swelling that happens when they have patellar tendonitis or jumper's knee. So the number one symptom is going to be pain right there. It is possible to get pain in other areas besides this. It's very common, in fact, to have pain behind the kneecap, above the kneecap, on the sides of the kneecap, generally anywhere in front of the knee. At this point, though, it's kind of more like another diagnosis. There's a bunch of knee problems, knee diagnoses that are made, depending on what part of the front of the knee is hurting, but they're all relating to the front of the knee. I'm talking about patellofemoral pain syndrome, but if you have pain directly down here, your doctor might tell you that it's patellar tendonitis. Now, the other sign or symptom is that you're active, that you're very active typically, maybe even involved in competitive sports, or maybe your mileage is high if you're doing cycling or running. Any one of these activities can overload the tendon. They can help to overload the tendon, but it has to do with the root problem. I'll tell you more about that in just a moment. Let's talk about the diagnosis of this. So if you go to the doctor's office, they're going to probably initially order an x-ray, and they do that just to make sure that there's nothing else wrong with the bones. They're looking for like stress fractures, microfractures, which can happen especially in distance athletes, runners, or people that are doing a lot of jumping activities like volleyball players, basketball players, track and field athletes. But you don't have to be an athlete or a runner to get this diagnosis. There are people that are just lifting weights and not being super aggressive that end up getting tendonitis right here in the front of the knee. Occasionally an MRI will be ordered by the doctor, and what they're probably going to be looking at is what the cartilage is like on the back of the knee, so they can see if there's any concern with that. They might also give you some information from the MRI on how the tendon looks right below the kneecap and above, because you can see swelling on an MRI. But most doctors will probably poke your knee right there, right below the kneecap where that tendon is or ligament, and they might poke other spots. They might bend your knee to see how it's moving and just test it. Some will test the ligaments in there too to make sure there's no like ACL tear. And after they do that, they'll ask you, of course, are you an athlete? Do you do volleyball, basketball, any jumping sports? Are you a runner? Do you do a lot of running? If you say yes, then they're probably starting to think already, oh, this is an overuse injury because you're an athlete or because you run a lot or cycle a lot, and this is officially now, because I'm a doctor, jumper's knee or patellar tendonitis. Another term that is thrown out there is patellar tendinosis and patellar tendinopathy. And without getting into all the details, it's really the same root problem. It's more just a matter of how long the problem has been there. If it's a recent problem that just popped up within the past few weeks, definitely the past month, then it's going to be an itis, tendonitis. That just means it's acute, or in other words, it just happened. Tendinosis means that it's been there for a longer time, and so there's some different processes that are happening inside the tendon as far as healing goes. But the root problem is still the same no matter what, whether it's jumper's knee, patellar tendonitis, patellar tendinopathy, patellar tendinosis. Don't get hung up on the terms. It's all kind of the same thing. And the reason they're all kind of the same thing is because they all share a common root problem, which I'll get to by the end of the video here. But first, let's talk about common treatments that are done. If you go to the doctor's office for your knee pain, they're going to right away tell you, stop doing the thing that's causing pain. So stop running, stop playing basketball, stop doing volleyball, take a break from practice, only play if it's light, or if you can play by yourself on the side, do some individual training, do some cross training. They'll give you activity modifications to help reduce the amount of activity that you're doing, or they may even tell you to stop altogether, especially if it's more severe, or if you have an older school doctor who's just kind of strict about what they say, kind of what they say goes, or what they learned back 30 years ago in school. That's how they treat you today. Sometimes they're giving you anti-inflammatory medications. There's both oral and injected anti-inflammatory medications. And the hope with that is to bring down any swelling that you have in the area. Another recommendation you might get is to wear a knee brace or a strap. There are jumper straps that just go right around the knee right here, right below the kneecap. And so those can temporarily help with pain relief as well. But let's talk about the root problem of patellar tendonitis or jumper's knee, because this isn't talked about in healthcare and it's not addressed by any of these treatments that I've mentioned. Medications aren't going to fix this. The braces aren't going to fix this. Resting isn't going to fix this either. The root cause of patellar tendonitis is that the muscles in the front of the thigh, the ones that attach to this tendon, the quad tendon right here, so that the quad muscles, they're too overactive. They may be too strong, but you're definitely using them too much. And so they end up pulling excessively on that kneecap and on the tendon below. And that's why you're getting pain here. You're putting too much tension, more tension than the tendon is ready for. And so it's becoming injured as a result of that. And if you're exercising frequently because you're in a sport and you're having to practice on a consistent basis, or your mileage is a lot if you're running or cycling, then you don't give it adequate amounts of rest to recover and heal itself and make itself strong enough to take on the next load that you put it through. So you're just doing too much too soon. But if you can rest it and calm it down, then the swelling does go away and the pain does go away, but the root muscle imbalance, the root cause of these quad muscles being too dominant and too strong won't go away. Resting alone just calms things down. It just helps the pain to flare down and the swelling to flare down. But if you don't look to address the root muscle imbalance, then once you get back to being active again, it's likely to come back. And sometimes it doesn't come back as just tendonitis again, because like I mentioned, there's a lot of overlapping problems in the front of the knee. You might start getting pain behind the kneecap or pain above the kneecap, which is more like quad tendinopathy or quad tendonitis. You could also get other issues like nerve problems, or the meniscus can be affected as well. So there's a variety of different issues that result from this root problem of having quads that are too dominant or strong. So the fix for that is to get the quads to stop compensating too much, which means you need to get some other muscles stronger that are not doing their job. Quads will begin to compensate if the glutes on the back of the hip aren't strong enough. So now if you think about the jumping sports that you might be doing or the running activities that you're doing, think back to how often you get fatigued, you feel tired in your glute muscles versus your quad muscles. Because my bet is that if you get tendinopathy or tendonitis or jumper's knee in the front of your knee right here below the kneecap, you probably feel your quads get tired first whenever you're exercising. And they probably stay tired the rest of the exercise. You probably get sore in your thigh muscles if you're still getting sore, because you stop getting sore after you've been working out for a while. But you probably never feel much in your glutes. And if you begin to train those glutes properly and get them stronger and then get them to activate at the right times, like when you're jumping, for instance, then you can begin to offload the tendon down here and prevent yourself from getting knee problems over and over again. Because that's the number one thing that I see is people will rest, maybe wear a brace, maybe take some pain medications, they'll follow doctor's orders, and the pain will go down. But then what happens when they go back to sports? They didn't really recover from the problem fully. They just got the pain down to where it's manageable, tolerable, maybe even gone completely, but the root problem is still there. It's just dormant, waiting to come back as soon as you get your activity levels up again and you begin to compensate with those quad muscles. The number one way that this is visible, the muscle imbalance, especially if you're in a jumping sport. If you can look at my legs here, my feet. When you go to jump, if your knees come together, when you go down to load for the jump and then you jump up from there, that's going to put your quad muscles in a position to work really hard. This is very common. This is a very common movement that basketball players go through right before they take their jump shots. Their knees come together and then they jump. And what we should be doing anatomically so that our quad tendons up here above the kneecaps and the ligaments below, the patellar tendons below, aren't being overloaded, is you should be squatting this way right before you jump to load. So you should be taking your jump shots with your knees out. You should be jumping for volleyball with your knees out. You should be running thinking about using your glutes rather than your quads, because that's going to ultimately offload the tendon on the front of the kneecap, right below the kneecap. If you're looking for help with correcting this problem, the root problem that sets up jumper's knee or patellar tendonitis, I've got a program of 30 videos of me walking you through all the steps from start to finish. It's as if you're here in treatment with me to fix the root of the problem. It's called the Patella Pain Recovery Program. You can learn more about it through a link in the description below. Just pop open that link and you'll see the Patella Pain Recovery Program with a link that'll take you to the page to learn more about it. And I've also got a playlist of all our runner's knee and jumper's knee videos linked in that same description down below. If you want to learn more about what we have to say about jumper's knee, if you're dealing with runner's knee problems, go learn about it from that playlist below. If this video was helpful for you, give us a thumbs up, share this with somebody you think needs to see this. If you're in a sport and you have a teammate that has knee pain like you, please have them watch this video. They need to learn about this as well so that they can keep playing the rest of the season with you. And please comment on here if our videos have ever helped you out. Just let us know. Update us on your story. We love to answer our comments. If you have any questions, please ask on there as well. And please subscribe to our channel and turn on the notification bell so that you don't miss out on any of the helpful videos that we post each and every week. Thanks for watching, friends. I'll see you in the next video. Bye-bye.